Hello, I'm Dr. Marla Shapiro. I'm a professor at the University of Toronto in the Department of Family and Community Medicine, and I sit on the Board of Trustees of the North American Menopause Society. I have the pleasure of being joined by Dr. Victor Henderson, a past president of the North American Menopause Society, who's well known for the Stanford Alzheimer's Disease Research Center and is professor of health research and policy and of neurology and neurological sciences at Stanford. So, cognition, forgetting, in and around the time of menopause. Women always blame menopause, but is what's happening in terms of the forgetfulness that women notice, the change in their ability, related to aging alone, or is it related to the decline of estrogen?
I think it's related more to aging, but to both. So there are changes that occur with normal aging during the midlife, before the midlife even, and after. But those changes are things that don't necessarily portend Alzheimer's disease or something worse coming up in the future. So there are different kinds of memory. Forgetting someone's name, for example, would be one kind of memory loss, but that kind of memory loss doesn't seem to have the same implications vis-a-vis Alzheimer's disease as other kinds of memory symptoms might. Forgetting why one walks into a room, what it is that you're going to get out of the room, retracing your steps, going back, would be another kind of memory loss, but not worrisome also. It would be more the memory, forgetting appointments, repeating conversations, not recalling what someone has said 5 minutes ago, 5 hours ago. Those kinds of memory concerns would be more important. And generally, this isn't what women are talking about during the menopausal transition or during other parts of the midlife.
It's more forgetfulness that they think about more than anything else, or it's on the word, or the word is on the tip of my tongue and I can't think of the word. Those are the types of complaints that we often hear.
Right. And those don't seem to have the same adverse relationships that other kinds of memory loss do. So those are common. It is age-related. It may be more common during the menopausal transition, but not a particular clinical concern.
So what about the use of estrogen in the period of time where women are really having terrible hot flashes and night sweats, the appropriate indication for using hormone therapy? What impact will that have, if any, in terms of these cognitive complaints?
Well, I think to the extent that cognitive complaints are influenced by mood, by sleep disturbances, by vasomotor symptoms, I think then menopause therapy, hormone therapy would have an effect on cognition. But in terms of more enduring brain changes, I'm not sure that it's directly related in that sense. There have been a number of clinical trials done looking at the effects of hormone therapy in midlife women, and by and large, they haven't shown much of a benefit or harm. That said, there haven't been large, well-conducted trials during the menopausal transition per se, and I think that's still an area of investigation, an area of need.
Certainly when we look at some of the newer cardiovascular data in younger women, we definitely we don't see any harm at all, and we do see some benefit being conferred. It would seem that that might be relatable to the brain for the same mechanism, but yet we have not seen that really.
That's true. I think the effects on cardiovascular system are emerging and becoming more solidified within the scientific literature, but these are midlife effects. And in terms of absolute risk, I think the magnitude of the change is probably pretty modest, even though important, even though relevant. And the time of greater vulnerability would be later in life. This is when cardiovascular disease is more common. This is when early symptoms or findings of Alzheimer's disease become more common. And this is a time where there would be differential vulnerabilities of using hormone therapy.
So one last question for our physicians who are listening. When should they begin to do some formal memory testing? What's the bell that goes off that says, no, this just isn't something that's usual in and around menopause, but I really should be more formal in my assessments?
I'm not sure I want to overgeneralize, but let me say two things. One would be the kind of memory impairment that reflects the inability to recall new information that was encountered a few minutes ago, a few hours ago, repeating questions, repeating conversations. That would be one concern. And the other would be, does this have some sort of functional impact? Is someone's job not being done properly? Are finances not being handled properly? Then there is the kind of memory loss that's more worrisome and it's having a functional effect. And then I would think more investigation would be warranted.
Thank you so much.
Thank you.